been tested and I will be tested again. I cannot run away from the front line. I have my teams that require me to be there. Neither can the WR run away from the front line. Neither can she run away from the front line. Neither can my scientists run away from the front line. So our humble appeal to Ugandans is to keep calm. We have a battle ahead of us. Let's avoid being distracted. Let's be focused and concentrate on the big battle. Timber, ibed pashu. Timber, pei bedi langeta woti. Neni, ibedu ten, beda komi yot, and igwok distance ni apoya.
Her alarm goes off and she gets up to watch the morning news. Doesn't work no more but tells a lot of stories about her youth. Drinks more lately, ain't got pills in many different colors too. Morning light is showing, she moves the chair to look out at her view.
Dr. Ruth Aceng, the woman at the front line in Uganda's fight against COVID-19. As Health Minister, Dr. Ruth Aceng has won plenty of public acclaim for the solid leadership she has offered the country during this difficult time.
Our heroes so brave and bold. Our heroes have been forgotten. Our heroes so they ain't got old. Our heroes have been forgotten.
But like she personally admits, Dr. Aceng cannot pull it off doing all this alone. It has to be a well-collaborated effort involving colleague ministers and other dockets on which she continues to rely for complementary support. Truth is that behind the scenes, there are many other Ugandans rolling their sleeves and getting their hands dirty while burning the midnight candle to steer Uganda through these hard times. But what Dr. Aceng has managed to achieve and her guidance during this period has been extraordinary. So who is Dr. Ruth Aceng? Ruth Aceng, born 11th May 1968, is a pediatrician and politician. She is the current Minister for Health in President Museveni's crowded cabinet. She was appointed to the position on 6th June 2016. Before that, from June 2011 until June 2016, she served as the Director General of Medical Services in the Ugandan Ministry of Health.
Planning for the health workforce in this country has been a nightmare because it has all been paperwork. We don't know how many health workers we have in this country. It is now good news. We have a system whereby just a click of a button, you know who is available in the system, you know how many health workers we have in the country, you know their qualifications, you know where they are, and you know what they are doing, and you know who has moved in and who has moved out.
She attended Shimoni Primary School, then Nabisonso Girls' School, for her O and A-level education. At school, according to her old students, Aceng was among the best science students, and it's no surprise that she managed to secure government sponsorship at Makerere University's College of Health Sciences. She holds a Bachelor of Medicine and a Bachelor of Surgery, a Master of Medicine in Pediatrics, Master of Public Health, and a Diploma in Health Systems Management from Israel's highest-rated Galilee International Management Institute. Her service began when she was a medical officer in the health ministry.
Indices in this the health indices in these areas are worse than those in the other areas. Of course, poverty and illiteracy have not helped. They have contributed highly to the imbalance. The instability, to mention but a few, have contributed the worst.
Dr. Aceng is married to Dr. Andrew Aliayo Ochero, and together they tied the knot in 2013 at Watoto Church in Kampala. At the time, she was appointed Director General of Medical Services. She was serving as Executive Director of Lira Regional Referral Hospital. Aceng is a member of the Board of Directors of the Infectious Diseases Institute. She also served as a member of the board of Uganda National Medical Stores, the pharmaceutical procurement and distribution arm of the Health Ministry from 2005 until 2016. Aceng won public support late last year when she led by example. Ugandans were skeptical about the country's mass immunization program. To allay any fears raised by social media experts, Aceng took her children for immunization. After the World Health Organization declared COVID-19 a global health pandemic, Uganda started enforcing mandatory quarantine as a way of nipping any possible spread of imported cases in the bud. Some complained about the move to quarantine many returning nationals and foreigners. Aceng visited those quarantined and a Germany national tried to interrupt her address. She shushed those undermining her efforts.
We are not just going to open our borders and then what is happening in Italy happens here, okay? So whatever, shut up. Let us listen. Excuse me. You will stay here for 14 days.
Let us respect the minister.
You will stay here for 14 days.
We find out the solution.
Whether you shout or you roll down, you will stay for 14 days.
When Uganda confirmed her first case of COVID-19, Aceng delivered the news in a way not to alarm Ugandans. It was the same thing when other cases were confirmed.
Fellow Ugandans, please do not let us miss this great opportunity that has been given to us to flatten the curve of the epidemic, to weed out the cases, to secure our country. Please practice social distancing. When you're on the road, practice it. Whether you go to the markets, practice it. When you are in the supermarkets, practice it. And the supermarkets should not allow in more than 5 people at a time. Practice social distancing and give Ministry of Health the opportunity to implement the strategy that we have explained to you today. And at the end of all this 14 days or more, we shall give you accountability of what we have achieved after the 14 days. So we are relying on you, and be ready to be evacuated. Why receive results in the night? Now, if you listen very carefully to Professor Kalebo, UVRI runs 75 samples in 4 to 6 hours. Every 4 to 6 hours, 75 samples. So if we are to run for 12 hours, that means you have 75 3 times, isn't it? You know that would come to nearly 225 samples. So that means they will finish sometimes in the evening. Now when they are done in the evening, or if they run it for 48 hours and they are done, they have to sit down and correlate it with the information they have received regarding the patients. So usually this will end about 5, 6, sometimes 8, 9 in the night. And it is only pertinent that when we receive the results, we communicate. I don't think it would be nice if we stayed with the results overnight and communicated it the following day. It would give more anxiety to those who have been tested. So it is the volumes of work that dictate and the processes involved. Because if we were to explain the process to you, which many of you will not understand, then you would know why it takes that long. So that is the reason why we communicate to you. We communicate immediately the results are received. Now regarding the guidelines, I want to appreciate the Interreligious Council of Uganda that ensured all guidelines were translated in 7 local languages. We have been printing, and we need to print volumes because we want to spread this all over the country. But we also had a challenge with the lockdown because the printeries were not categorized as essential. And so we had to go back and renegotiate for the printeries to be opened. And now we are beginning to print again because we need volumes. And we shall ensure that it is distributed all over the country in all the languages. So our humble appeal, bear with us. The systems will continue to be improved as the situation evolves.
Her eloquence and ability to lead Uganda in this global pandemic has even led many Ugandans to suggest that she is best suited to even carry on as president when Museveni retires. After all, she has proved her doubters and many mafias wrong.